are there ways to ease itching besides the standard topicals, emollients, such as with food or supplements? Alternate ways to improve skin barrier and or immune system that helps.
I wish I had a great way to answer this question. This is probably one of the toughest things that we do as dermatologists. I think I would take a step back and say the most effective thing tool we have to treat itch is to treat the therapies that Dr. Pro might provide, or therapies that a dermatologist might prescribe. In terms of soothing itch, aside from creams and emollients, there are oral pills that can be prescribed that might help lessen the itch. But if someone is looking for a more kind of naturopathic approach to treating itch through food or supplements, there are no particular foods or supplements that have been studied directly in the context of lymphoma, and certainly the research isn't in other dermatologic conditions to really give any advice with great confidence. I will say that there doesn't seem to be anything that we know of that can make it worse. Aside from that, some basic things that are beyond sort of topicals and emollients that can be quite helpful. And I know a lot of people don't like the sound of this, but it's taking dilute bleach baths. So it's basically turning your bathtub into a swimming pool. Very safe. Even young babies who have eczema do the same routine. Does is it's likely anti-inflammatory and quite soothing for the skin. So we know that this can really help itch in some folks who have pretty widespread disease. Or good old oatmeal bath, and in many CVS's or other pharmacies, you can find these little oatmeal packets that you use to dissolve in the tub to kind of get a soothing soak that's beyond the topicals and the creams.
Right. Is it possible to have more than one variant of cutaneous lymphoma at the same time, and how common is it?
Yes, I think it is possible that one individual may have more than one variant of lymphoma or carry multiple diagnoses under the umbrella of cutaneous T-cell lymphoma. With that said, it is highly, highly uncommon, and not something that I see typically. I think the most common example might be someone who has lymphomatoid papulosis and primary cutaneous anaplastic large cell lymphoma, or someone who has mycosis fungoides and lymphomatoid papulosis. With that said, there are some patients who look like a classic mycosis fungoides patient who presents first with fixed, patches or plaques, so fixed spots on the skin, and over time develop disease in the blood and more widespread involvement in the skin. So they might actually then look like they have Sézary syndrome. So there is a little bit of overlap between these diseases. It's not always easy to separate what diagnosis a patient carries at any given time, but not common.
What is the biggest impact cutaneous lymphoma has on a patient's life typically? And I think this is something that both of you could have some insight on.
Yeah, I have to say this is a question that we are really interested as a physician to try to understand more. But the answer really comes directly from patients, and they're our greatest teachers here in terms of helping us understand how cutaneous lymphoma affects any given individual. And there's no right or wrong way in which the disease impacts someone's life, and it can really vary from early stage to advanced stage. So again, this is a very difficult one to answer, but I can certainly say that some of the emotions and stresses that patients have shared with us along the way really range from a lot of sort of fear and anxiety about the unknown, kind of that question regarding risk of disease progression, the kind of fear and concern that comes with living with a cancer, the sense of otherness that no other individual carries such a rare condition like yourself, and a lot of sadness sometimes around this diagnosis that sometimes can be Aside from that, there could just be plain annoyance and anger because there's so much maintenance involved in treating the skin, especially if you're doing combination therapies that require a combination of medications that Dr. Pro will give plus topical steroids. So there's a lot of ways in which it can really affect a person's well-being. And that's not even beginning to talk about the symptoms that someone might feel from their cutaneous lymphoma, from itch, burning, stinging, irritation, just the flaking that occurs. And again, those symptoms vary across the spectrum of disease. So it's really hard to say how any one person should feel with lymphoma. We certainly have many patients who are able to go on and lead very happy and successful lives and keep their disease well controlled. But we know that's not the case for everyone. So it's really difficult to say, but we want to learn more from you. And the more you share with the doctors, the better able, hopefully, they are to help one another.
Does large cell transformation always mean it will attack internal organs?
I can take that, and then maybe Dr. LaRocca can also add her experience. So not necessarily, okay? There are some patients where we do multiple biopsy because something has changed with the disease and we feel like it's getting a little bit more aggressive. And we do find evidence of large cell transformation in the skin. But when we do imaging study, because again, if you find large cell transformation in the skin, you need to find out whether or not any of the organs are involved. So you need to have either CT imaging, so CAT scan, or these days we prefer a PET scan. And so to make sure that there are no lymph nodes or any other organ involvement. So in some patients, the large cell transformation is confined to the skin. But in other patients, absolutely true, it can attack other organs. So we need to find out, because if that is the case, they will need systemic chemotherapy. That's usually what we typically do.
My skin has become increasingly frail, cuts and bruising. Is there anything I can do to build up an armor or resistance?
This is a tricky question because there's a number of different things that can make people's skin more fragile. As we age, the inner layer of our skin called the dermis does get thinner, and that makes skin more liable to bruise or tear easily. Use of topical steroids on the skin can make this much worse. Any topical steroid, especially if they're really strong ones, can thin the skin and make you more likely to get cuts and bruises. Ultraviolet light over the long term, over many years, can do that as well. So I think a couple of things. If you are using topical steroids all over your whole body, that's a good discussion to have with your dermatologist if there's something else you can do, because that may be contributing. Sometimes we can use a topical medicine called a retinoid. They actually build up the skin slowly over time, and that can sometimes help a little bit. But I wish natural aging could be reversed, but it's not a perfect thing. So,
is there a cure coming?
So I'm also going to defer to Brad on this one. I think there's some interesting things coming.
Yeah, it's always challenging to come up with a end-all cure-all for this type of disease. You know, we do have. So the short answer is, for most individuals, there's no cure. You know, there are some cures with things like bone marrow transplant or donor bone marrow transplant, but it's not an option for everybody, and it carries a lot of risk with it. That would be the only potentially curative option for cutaneous T-cell lymphoma as of 2022. But there are lots of exciting drugs coming down the pike, and who knows what the future holds. There may be cures, but the one thing we can say right now is that there are really exciting drugs out there, and we have a lot of drugs in the toolbox that people can work for individuals and can go and live their life and have great quality of life and just take, a pill like Accutane, like we're mentioning before, that doesn't cause in most people, a lot of side effects. But there are lots of other exciting drugs in development, other immunotherapies, cell therapies, lots of exciting things coming down that are in clinical trial and under investigation. And, certainly hope that something will come along that is a bona fide cure and something that's a carries much less risk than things like a donor bone marrow transplant, which would really be the only potentially cure now.
Can CTCL go into remission?
I guess I can start off and answer that question. So certainly CTCL can go into remission. We have lots of potential therapies, which we can elaborate on, and both skin-directed therapies that Dr. Pacheco can elaborate on that are obviously focused on the skin and direct to the skin, and then other systemic therapies. And any number of these therapies can lead to a remission. And remission can be defined as complete remission, where all of the skin lesions go away, or partial remission. And one of our goals is usually to get someone into a complete remission, and certainly that's possible with the number of different therapies that we can offer. I don't know if
Dr. Pacheco, would you like to add to that?
Yeah, I can talk about kind of the skin-directed therapy in early stage disease. So we stage disease, based on the amount of skin involvement. And I think it's fair to say that if you have early stage disease with limited skin involvement, it's fairly easy to get patients into remission. And again, we have skin-directed therapies like phototherapy, topical medications, localized radiation. So there are lots of treatments for early stage disease, and it's very likely that patients can go into remission with early stage.
Is bone marrow transplant considered a curative option? Dr. Pro, do you want to tackle on this one?
Sure. I think, in advanced stage disease, you would not offer a bone marrow transplant in patients with early stage disease. But in advanced stage disease, we do think that bone marrow transplant is probably the treatment modality that will offer the best chance for a cure. Although I have to tell you that a number of patients after stem cell transplant can actually have recurrence of disease, but in most cases, I would say the disease has a different clinical course. Typically, patients who have a transplant and have progression afterwards have very limited disease. And in those cases, we tend to treat them with some sort of maintenance therapy. So it's curative for some patients, but not for all. And that's why we need to really try to find more effective therapy that is not bone marrow transplant. Also, it's very hard to achieve what we call a complete remission, meaning that complete clearing of all the skin lesion and any other lesion that is in any organ with currently available therapies. And the best chance for cure is in patients who have no evidence of disease before transplant, but this is very difficult to achieve.